keep going, maybe. Let's see. So I know we talked about gauze. I think we did the gauze at the very end because I passed it around. Okay. So Egyptian times. We're gonna get through as much as we can. So that I know we've still got another day. Probably we'll have to get through the rest of it. We're gonna get through as much as we can. So physicians were the priests. They had actually specific priests that worked as physicians, but again, not the same as the priests who would be embalming. So different priests for different things. When we say priests, you know, it's not like thing of today's priests. I mean, these were like, you know, they had many gods in their belief system. So, bloodletting or leeches. Have you ever heard of either one of those?
Heard of bloodletting, but I mean,
Is it where they like suck all the blood out of your body?
Bloodletting would be like they would do like an incision type thing into your vein and let a bunch of blood out. They believe that would release either like bad spirits or sickness and things like that. So that was something that they would do, which is pretty dangerous. I mean, you need your blood, so it's not like, I mean, you can get rid of some of it, but you wouldn't need most of it. Leeches is something that was used as medical treatment, and one of the things that they actually use leeches today. My very first patient I ever started an IV on had leech therapy. And so he was at work and had on his wedding ring, and he was getting off a piece of the equipment, like a machine or something, and just grabbed onto a bar to like swing off of it to land on the ground. You know what I mean? Just like kind of hang on to it. And when he did, there was like a bolt or something sticking out, and his ring got caught on it. And it like pulled his ring, so his ring was like oblong, so like this, it was almost flat, and it just like took his whole finger off. Yeah, it's pretty gross. It like cut all the skin, and then it stripped it. So he actually had this bottom, this is called your proximal phalange. This bone was still intact, but these two bones and all the skin and muscle and everything had come off.
I saw a picture of that the other day.
So what they did was they sewed it all back on, sewed his finger back on, sewed his blood vessels back together and everything. And then they put leeches on the end of his finger. And what they do is because they suck blood, they actually pull blood back into like where it had been cut off before. So it pulls blood back in so it can heal. Pretty crazy, huh?
How long do you have before you can't sew something back on?
Not very long. I mean, it has to be done pretty quickly. And then anytime anything like that happens, you always want to put it on ice. You don't want to put it directly on ice, but you want to wrap it up like in a towel or something that's clean, and then put it on ice, like in a cooler or a bag of ice or something. Not directly, and then take it with you too, because a lot of times they can put it back on. So, I read, what was that article at the end of the year last year? This man had gotten, it was in like China or somewhere. I should look it up. It's really interesting. Anyways, he got his arm cut off in like a factory or something. He was working. Or maybe it was just his hand. Maybe it was just his hand, like the lower part of his arm. Anyways, and they couldn't reattach it right then because of all the trauma that had happened to his arm. And so what they did was they attached his hand to his ankle. Like they attached it to his, like the lower part of his leg, so that his hand would stay intact and it would still get blood flow and everything, so that they could reattach it later.
So after they finished, I took the hand off his
leg and reattached it. So I don't know how much use he would have out of that hand. I mean, I don't know. It might be more useful to actually get a prosthetic hand. I don't know. But anyway, that's what he did. I mean, there was like this big picture of him with his hand on his leg.
Oh, no.
Really crazy. It's crazy what all they can do, you know.
But think about it. That's your hand. You'd want to save it.
Yeah. No, I agree.
So, I don't know that I wouldn't do that.
Yeah, I mean, I don't know what I do. I guess it depends on how much they think you would have use out of it. I mean, if you would have no use, I don't know. It's be up to the person. I had I remember watching the surgery one time at Scottish Rite, and this kid didn't have, something was wrong with his joints, and I don't remember, he was really young, but anyways, they ended up, he had his feet, but his ankles have just pretty much, they were just like stuck where they were with his toes pointed all the time, so he couldn't walk or anything. So they actually amputated his feet so he could have prosthetic feet so that he could learn to walk,
Mm-hmm.
So there's times when that's a better alternative, but really interesting. But leeches can be used that way because they pull blood to that area. And blood carries what?
Oxygen.
Oxygen. And all of your cells have to have oxygen to survive. The more oxygen a wound or something that's been injured gets, the faster it will heal. Average lifespan was 20 to 30 years. Now, did I explain the lifespan thing? I did, didn't I? It's not necessarily that people only live to be 20, but it's just that that's the average. Okay, research on mummies has revealed the existence of some of these diseases that we still have today. And this is a test question, so know that. Arthritis, what is arthritis?
It's like joints.
Yeah, it's inflamed and pain in your joints.
Okay, can kids get arthritis? Okay, I think I got arthritis.
Now, I would probably not osteoarthritis like you get from repeat use, but like if you injure something, like when I was in high school, playing basketball, I broke my finger, and so it has arthritis in it. I can already tell because it won't bend, and whenever it gets cold, it won't bend, and it hurts really bad and it swells. So usually, if you're younger and you have arthritis, it's a result of some kind of injury. But some people have what's called rheumatoid arthritis, which is actually an autoimmune disease. You're born with that. So that is, but there's a lot more to rheumatoid arthritis. It's like severe pain. There's just a lot to it. You have to take steroids. But arthritis is one thing that actually looked at mummies and determined that it existed then. Kidney stones is another one. So when they've done research on mummies, they've found kidney stones. And then arteriosclerosis. Any idea what that is? See any word that looks familiar in there?
Artery.
Artery. Good. So arteriosclerosis is a hardening of the arteries. So that's what happens whenever you get a whole lot of like cholesterol buildup inside your arteries. They get really hard. They won't stretch anymore. Like they should be able to stretch, but they can't when you've got that going on. Okay, some medical practices that are still used today. Actually, maybe this is the test question. One of these is the test question. If there's a test question right now. This one or the last slide. Enemas. Anybody know what an enema is?
Mm-hmm.
An enema is something that they use when someone is very constipated. And you actually put there's several different things. When I was in nursing school, we used what's called soap suds enemas, where you actually get kind of like an IV bag, and it has a tube on it, and you put water and soap, just a tiny little bit of soap in it, and you actually put that into their rectum and tell them to hold it as long as they can. And what it does is it helps to break up fecal matter that's gotten really hard and won't come out. So, but enemas, you can actually buy them at like the dollar store, wherever they come. Some of them come ready-made. They're like a little tube. Not a real comfortable procedure, I would think, but necessary enough. But they can tell that they use enemas, and that's something that we still use today. Pretty common treatment.
Don't they do that?
Not my favorite thing to do as a nurse, but fairly common. So.
Don't they do that before you have a baby like they used to? I think
they used to.
Because I think my mom did.
Anymore.
But I don't know.
So I know there may still be some hospitals that do that, but I remember I had a little kid one time in the emergency room who came in constipated, and his mom was like, "Why is he getting constipated? So what does he eat?" She said, "I can only get him to eat Doritos and pizza." Well, there you go. Lots of cheese, lots of bread, and lots of carbs. Anything that stops him up, everything that does that. So poor kid. So I had to give him an enema.
Aww.
He was like 3. And so gave him the enema. I was like, "Do you have to go yet?" He was like, "No." Of course, he screamed during the enema. He wouldn't. What 3-year-old wouldn't? And I was like, "Okay, you got to go yet?" "No." "You got to go yet?" "No." And then I walk up and he's like, "I gotta go. So he runs to the bathroom, comes back, and he's better and everything. And he's leaving. He was like, "Bye. I had fun." I was like, You
No,
didn't
you
have
didn't.
fun. Whatever. I guess he felt better. So
Mhm.
it's so cute. Not very many people would say that after having an enema. So some other things that they practiced, circumcision was something that they practiced. But then it preceded marriage. Now it's usually done in a hospital right after the baby's. I mean, within a couple of days after the baby's born. Usually right before they go home. Closing wounds. So, in like suturing wounds, sutures and stitches are the same thing. Sutures are kind of like the medical term. Stitches are kind of the everyday term. Does that make sense? So they can tell that they use those, and then setting fractures. So they can tell that they would put bones back into place and then set them somehow. Like with maybe they used, I don't know if they used like a stick and wrapped it around or something like that. You know what I mean by setting fractures? Oh, I put this in my notes too. That trephining, that we talked about, where they would take out a portion of the skull or drill into the skull and let out spirits. So that sometimes they would use the scrapings from that to make like potions and stuff. Gross. I know how to do medicine. So okay, the ancient Chinese. So it says they believe in the need to treat the whole body by curing the spirit and nourishing the body. So again, still have this idea that medicine is very related to spiritual things. And not that that's so far apart, but for the most part in ancient times, they believed it was all related to spiritual things, Says they recorded a pharmacopoeia of medications based on their use of herbs. And the pharmacopoeia is just like a list of medicines, basically, that can be used and how they're used, when, and so forth. Like we have the USP, the United States Pharmacopoeia. It lists all the medications that are available, and what they would be used for and so forth. So that's all it is. It's just a list of things that you might use. Use therapies such as acupuncture. Still kind of blows my mind how acupuncture works. But anyway.
How does that work?
It blows my mind. I don't really understand it.
But
But they use pressure points. They use like little needles and they put them into pressure points. Have y'all probably seen pictures of it before? Ever seen pictures? They put needles like all over your body.
Oh, okay.
Little bitty,
Oh,
little
yeah, like
bitty.
it's like sometimes like you get on your back.
Nope.
So it says, look here, that they began to search for medical reasons for illness. That's significant. I mean, that's something different than what had been the case for the last thousands of years. Average lifespan didn't change a whole lot, okay, because there's still no medicines, no new treatments, nothing like that. Okay, ancient Greeks. So a little turnaround here. It says they're the first to observe the human body and the effects of disease. So this led to our modern sciences. So they're the first ones to look at, okay, disease, like there's more to this than just you made the spirits mad and you have a disease now. Like they start noticing that some people have the same symptoms, which makes sense. We know that. Believe illness is a result of natural causes. So that's something that's new. Now that still wasn't widely accepted, but it's coming into play. And that's really important. Stress, diet, and exercise as ways to prevent disease. Pretty smart, right? Getting somewhere. We know that is the case. Average lifespan starts going up. They start realizing why illnesses are occurring, then that helps them to understand what, that gives us a little more span on our livelihood. Okay, some important people as far as Greeks go. Hippocrates. Everybody heard that name before? Probably.
Yes, we had to research him.
Oh, you did? Where'd you go researching it?
Like we're doing our project and we had ancient Greeks and stuff, and he was one of the persons.
Good. Oh, for this class. I thought you meant you researched in another class.
Oh, no.
Sorry. So, very important guy in the history of healthcare. I mean, he's actually called the father of medicine. So, father of modern medicine, anyway. Says he took careful observation of signs and symptoms of diseases. So, observation just means that you look, you observe, see what's going on. So he noted that, okay, this person, this family lives in the same house. They all have the same symptoms. There must be more to this than what we think, what we previously thought. Determined that disease was not actually caused by supernatural forces. Light bulb, that seems so obvious to us. And that's the thing. There's so many things in here you'll see. There's like, oh my gosh, that's stupid. Why do they do it that way or whatever? You should know. People haven't taught you things as you go. You don't know them. We know things because people teach us and we read them. And we educate ourselves. But if that knowledge hasn't come about yet, how do you do that? It's just like when I went to Africa. No one ever, they've never been, or some of them, yes, but there were people who came that had never been taught to, what soap was, or that they needed to wash their hands every time before they ate, or that they needed to go to the bathroom in a different place than where they got their drinking water from. They've never been taught that. They don't have any equipment to test it or do anything like that. They wouldn't know how. So how can we expect that, it's not just to us, it's just common sense, but if we've never been taught that before, it's not common sense, So again, like I said, he's considered the father of modern medicine, wrote standards of ethics, which is actually the basis for today's ethics, like what we go by. Y'all understand what ethics means? Your morals is kind of like what you believe about right and wrong, and the ethics are just the standards that are set in light of that. So, for example, one of the things he talked about was that in his ethical code was that you couldn't purposefully harm someone. So as a doctor, you have the ability to easily hurt somebody or kill them. If you prescribe the wrong medicine, too much of a medicine, something like that, there's a lot of responsibility there. Well, one of the things in that standard, that code of ethics, is that you can't purposefully use your knowledge as a doctor to hurt someone. That makes sense. Mm-hmm. That's an ethical thing. Right? We would consider that if a doctor wrote a prescription for someone on purpose because they didn't like him or they were mad at him or whatever, and it made him sick, that would be unethical, right? Wouldn't you think so? Mm-hmm. They would probably get sued. So, said his students followed strict ethical codes and swore they would keep privacy, not going to share everybody's business with everybody else, and then not deliberately harm them, like I said. And he came up with what's called the Hippocratic Oath. Have y'all ever heard that before? Mm-hmm. Hippocratic Oath is just like a statement, or it's an oath, but it's something that physicians actually repeat and state whenever they get their, like they graduate and all that. Like they actually do the Hippocratic Oath. And they can't go against that. It's just an ethical code. Aesculapius, I'm saying this. So he was, he's the Greek god of healing. And one of the representations of him was this. It's called the Caduceus. Y'all probably seen that picture before. Everybody ever seen that picture before? Yeah. Like a hospital sign or something? I know the old hospital in Paris had that sign out.
Yeah.
Anyway, so that's where that sign came from. Came from the Greek god of healing. Temples were built in his honor, but I wanted you to know that now it's kind of a symbol of medicine, but that's where it came from. Okay, ancient Romans. So they were the first to actually organize medical care. And so in doing that, they provided care for their soldiers. When I say organize, they had, kind of a routine of how they're going to do it, that they're going to put all the sick people in this area and so forth. Does that make sense? They're the first ones to really organize. And the reason that hadn't been done before is because they thought it had to do with supernatural forces. So it was like, it didn't have anything to do with them needing to be quarantined or anything like that. Thus later hospitals were religious and charitable institutions and monasteries and convents. So that's kind of where you saw the hospitals. It says the first public health and sanitation systems. So they're the ones who built those. It says by providing sewers and aqueducts. Why is that significant? Sewers and aqueducts.
They got rid of the germs.
Good, yeah. It moves the germs away from where the living area was, right? And we know there's lots of bacteria in waste, sewage waste. And it's just like I was talking about, like one of the things we would work to teach when I was in Africa, or they had been in that area, was that, okay, if you've got your water source coming down this mountain and it's sitting down at the bottom of this hill, and that's where you get your water, but yet you put your latrine or like your outhouse right next to that stream, and it also drains down into that water, everybody's going to get sick. You know, one person's sick, everybody's going to get sick. So it's the same idea here. When they built these, you know, that moved that waste away from where everybody else was, so it helped them not to get so sick. It says Galen established a belief that the body was regulated by 4 body humors. And Galen, I believe, was a student of Hippocrates, I was thinking.
Or Plato, I'm not sure.
Look that up. Don't write that down. I may be wrong. I can't read my own notes, so I'll look at it later. Anyways, okay, actually, Galen was trained by the Egyptians, and then he came back over. It says that he, and this is something extra, it says that he documented the functions of the spinal cord and the kidneys. So Galen did that. Documented the functions of the spinal cord and the kidneys. And he also did a lot of research. Okay, the 4 body humors. Humors, when you hear that word, it just means like liquid or like your like you have what's called a vitreous humor. That's the really jelly-like substance that holds your eyeball or helps it keep its shape. Humor is just kind of like usually like a really thick kind of liquid. So then we have 4. We have blood, phlegm, black bile, and yellow bile. Now, obviously, that's not really the way it is, but that's kind of the count of that. Well, yellow bile makes sense because we do have bile. That's what comes out of your liver. It helps to break down fat. So that's one example. Now, they'll get expanded on over time, but just it was a good starting place. And I will look up, I wrote some notes on here that are kind of, I don't really remember what I wrote them for, so I'll let you know. Galen versus Hippocrates. I think Hippocrates might have actually come up with the body humors, and then Galen just expanded on them, but I'll let you know. I'll look that up in a little bit. Lifespan still kind of going up. Oh, here it is. I don't have this slide on mine. So, trained by the Egyptians, documented for, I already said all that. I need to switch this. Let me do that real quick. I might switch this on yours. There we go. I messed up something there somewhere. So that should have been Hippocrates instead of Galen. Now I messed it up. Right here. What's happening? My computer. Yeah. Okay, right here, I had Galen here. Change that one to Hippocrates. Sorry.
Oh,
Hippocrates is the one that came up with it. Galen just added to it. So, sorry, I forgot I had this slide on there. I don't have it in my notes because I made this after I made my notes. So he just furthered the research on those. Sorry for that confusion. Okay, the Dark Ages. Yeah. So at this point in time, the emphasis was on saving the soul, and the study of medicine was prohibited. So now we go back. We're like going backwards. And notice, because we're going backwards, so now they're not even allowed anymore to study like the cause of disease, like Hippocrates had said. Now they've gone back to this idea that it's all caused by supernatural forces. But look what happened to the lifespan when they did that. It dropped back down. Which makes sense because they were going backwards. I mean, they weren't really, they weren't recognizing anymore what was the true cause of illness. It says prayer and divine intervention were used to treat illness and disease. Monks and priests provided custodial care. That means just cared for them for their needs, like feeding them and keeping them, that kind of thing. Medications again were herbs, which we've seen for quite some time at this point. The Dark Ages, one of the things, and I didn't say this, but one of the things with the Dark Ages is that it began with the fall of the Roman Empire, and so I'm wondering if some of that maybe is why they went back and said, no, we're not going to believe that way. It was kind of like out of rebellion of that earlier empire, so that could have been part of that. Okay, Middle Ages. So it says there's a renewed interest in medical practices, so now they're switching back. They're like, okay, maybe there was more to this. Maybe because our lifespan has gone down. I don't know. It says the bubonic plague killed 1/3 to 1/2 of the population in Europe and Asia. Everybody heard of the bubonic plague, or sometimes it's called the Black Plague? Okay, they had, I don't know if I have a picture. I don't have a picture. Actually, they're, no, I don't. The bubonic plague actually was started by, I write this in there, I can't find it. It's called the bubonic plague because one of the things that would happen is caused by a virus and very, very contagious and obviously pretty lethal. If somewhere between 1/3 and 1/2 of the entire population of Europe was killed by that virus during that time period, which is, that's a ton. That's like major, So one of the things that it's kind of a hallmark system is they would get what's called a bubo, but that's just a really swollen lymph node. So it could have been at their neck, groin, armpits. Those are kind of the main areas you usually see really swollen lymph nodes, So that was one of the signs. Fever. I think that those would open up and then the flesh around those would die. I think that's probably why it was called the Black Plague, but anyway. The way that what happened was it actually started in China years before that. And when China, they would ship goods back around to Europe. And so what would happen is they were actually had fleas is what carries the virus. And so their rats on those ships would have fleas. And then whenever they would land over in Europe, those rats would get off the ship, go, find a house or wherever. Fleas would then bite people that were carrying it, and then the people would get it. But it's pretty intense. It said that it would cause death usually in like 3 to 4 days. That's how fast that virus, that's how fast that time period was. So here's what's interesting. So in Mongolia, was the first incidence of it. That was in like 1320, and then in China in 1330, about 10 years later. And then from there, it said that, or whatever research I did, said that Italian merchants picked it up on their ships, brought it back to Europe. So over a span of like 30 years is kind of how it traveled back around. So Europe, I think it was like a 3-year span where the bubonic plague was at its worst when it killed so many people. Pretty crazy.
3 years is a long time.
Yeah, it is for something like that to be around. Of course, it probably spread. You know, back then, people, I mean, they lived in such close quarters that was, you know, that was a big issue too. Other major diseases included smallpox. Everybody heard of smallpox? That's what, we don't get that shot anymore, but any of y'all's parents have that. There's like a scar on their arm right up here. Maybe your grandparents. So anyways, it's usually about that big, like the size of a nickel probably. And that was a smallpox injection that they got.
Why did they give them a scar?
I don't know exactly what it looked like, but it must have made like a scab and everything. Because everybody I know has got one of those scars. I don't know if it was lots of needles in one big thing or what, I don't know. It looks like it must have been pretty painful though. Anyway. Diphtheria, which is a flu, not flu, I think it's similar to flu virus. That's what y'all probably all had what's called the Tdap shot. I think you had to have it before you got into high school. Tetanus, diphtheria.
Oh yeah.
pertussis.
That was awful.
So, that's what diphtheria, that's what the D stands for. Pertussis is whooping cough.
Mm-hmm.
Tuberculosis, which is a lung infection. We'll talk about tuberculosis later on this year, but tuberculosis is it was very easily. If y'all ever watched the movie, I think it's Tombstone. I watched the movie Tombstone.
Probably same part of it.
Anyways, there's the guy on there that has tuberculosis. They usually, the old westerns, you see it a lot. They'll cough up blood. They always call it consumption. Is another word that they used to call it. That's tuberculosis. They get nodules, this bacteria in their lungs, and then they cough up blood. It's not usually quite like it is on the movies, because I've seen lots of people with tuberculosis when I was in Ethiopia. That's one of the main illnesses that we treated. But it's usually really like thick, mixed with phlegm and everything else. It's not like bright blood that comes out like they always show in the movies. It could be maybe towards the end, but it's usually not quite like that. Typhoid, which is it's something that you get from drinking bad water. That should be plague, not plaque. And then malaria, which is spread by mosquitoes. Did y'all know that if a person has sickle cell anemia, they cannot get malaria?
What's sickle cell anemia?
Sickle cell anemia is a blood disorder where your blood cells. She gets blood transfusions a lot. It's where the blood cells, see how normally on that poster back there, they're usually shaped kind of like donuts. See that top right-hand picture? Normally they're shaped like that, but when somebody has sickle cell anemia, their body will go through these crises where all of a sudden their bone marrow starts making red blood cells that look like sickles. I mean, they're kind of shaped like this. They're like, I don't know what a sickle looks like a crescent shape instead of round like that. And the problem is they can't carry as much oxygen, and they get all clogged up in those little bitty blood vessels, so it causes severe pain, especially like fingers and hands and feet. And then, but they can't, there's some, I don't know why that is, but somehow the people who have the trait for sickle cell anemia cannot get it.
Like, is sickle cell anemia like a disease?
Yes, something you're born with.
But is it like, can it kill you? Or is it just
I mean, I guess the sickle cell anemia technically can't kill you, but some of the effects of it could potentially. So, I mean, people live with it for, a long, long, long time. It's just a matter of keeping it treated and making sure you get help when you need to. They began requiring physicians to have licenses. That's a good idea. You want to make sure that they know what they're doing, right? Realize that diseases could actually be contagious. That's an important thing to realize, right? Because if you're contagious, what are you going to do?
Spread it.
Yeah, that's how it gets spread. So want to keep people who have the disease away from the well people. So cities became really common, which was an issue because now you got people moving in closer together, more people getting sick because they do live closer together and so forth. Average lifespan is about the same, hasn't changed a whole lot at this point. There were these people called barber surgeons, and kind of interesting. So they were the barbers, but they also did the surgeries. I guess because they had scissors, I don't know. Yes, same people who cut hair also did these procedures. So one thing they would do is bloodletting, like we talked about earlier, where they would let blood out. Like if you were sick, they thought if you got some of the blood out, you'd be better. Cataracts. Can you imagine? Yes, that's on your eye. You know, sometimes people get a really cloudy lens over their eye. They have those removed. Okay, can you imagine going to your barber shop and have your lens cut on your eye? And then amputations. Everybody know what amputations are? You get like an extremity, arm, leg, finger, or something cut off. Y'all know the picture. It's kind of interesting. Let's see. Try to cover everything. If y'all ever noticed on a barber shop, a lot of times it'll have that, like there's this little, I don't know what to call it. It's like a sign, but it's got the spinny red, looks like peppermint.
Red and blue sometimes,
yeah. That was supposed to, I guess this is when they started using those because it represented, I guess the red represented blood because they can do both. I don't know. But it was like a sign outside their door that they were a barber surgeon.
That's weird.
The Renaissance, so a little bit ahead in time, dissection of the body led to increased understanding of anatomy and physiology. Did y'all hear about, on the video you watched last Wednesday, did y'all see anything? Did they talk about the anatomy? I think it was Da Vinci doing the anatomy drawings and
I guess that wasn't, what day was that?
it was Wednesday, the same day as the test. It was after the test.
Oh, it was like that video. Yeah.
Oh, yeah.
Because they, one of the things they talked about was how, you know, the people who did that were, or look, the Salus, I guess it was really looked down upon because he was doing those dissections, and so it was kind of like a taboo kind of thing, you know.
We didn't get to finish it. I don't remember that.
And you may not, I know y'all didn't finish it, so I may not have gotten that one. So the invention of the printing press allowed medical knowledge to be shared. Really important. So now they had textbooks. So you have all these people before cutting holes in people's skulls, letting blood out, doing amputations, and they never had a textbook before. Oh, pretty crazy. First anatomy book was published by Andreas Vesalius. And then look, average lifespan is going up because they're finding out more, and they know that things are contagious, and they're able to treat things better and keep the sick people away from the healthy people. Okay, 16th and 17th centuries, the cause of disease was still really not known. They knew it wasn't supernatural forces, but they still didn't really know what was causing it because you can't see it, right? We don't see germs. And a lot of people died from infections because that's not something that you know that you can just see without a microscope. But look, it says invention of the microscope allowed physicians to actually see the organisms that were causing the diseases or illnesses. Okay, apothecaries made, prescribed, and sold medications. So these were like the early pharmacists. Now it wasn't anything like it is now. It wasn't like, there weren't a lot of regulations, things like that. I mean, it was just, I guess, just kind of did, whatever they knew to do. Ambrose Paré, I'm not sure if I'm saying that correctly, but it says a French surgeon known as the father of modern surgery established the use of ligatures to stop bleeding. You know what a ligature is? Like a tourniquet. They would tie something really tight, like they're going to do surgery on your leg, they'd tie something really tight up here to cut off blood supply so you didn't lose so much blood. And then the average lifespan is still going up some. And I hope I'm saying some of these names right, but just know that I may not be. So, Anton van Leeuwenhoek says he invented the microscope lens that allowed for visualization of organisms. Let me turn this off so you can see that picture. Kind of very rudimentary, you can say. I don't really even see exactly how it works. It says scraped his teeth and saw that there was bacteria living on his teeth. That's actually what made his teeth, what would make teeth break down. So I'll just scrape our teeth and look at them and see what comes off. Benjamin Franklin, we've all heard of him before. Don't know if you've been bifocals. Don't know what bifocals are?
Like an island.
Well, bi means two. So that's like the glasses that you'll see people have that you got regular lenses and then they have those magnified
Yeah,
glasses.
somebody
Those are bifocals.
I'm gonna ask how chicken stretch.